Part 4. The future of folate-based approaches in psychiatric symptoms. As we learn more about inborn errors of metabolism, or IEMs, we're seeing more situations where psychiatric symptoms can improve with targeted metabolic care. As of 2025, 1,564 different IEMs have been identified. That matters because it suggests that within everyday psychiatric practice, a subset of patients may have symptoms driven by an underlying metabolic defect. So the future isn't about giving everyone folate. It's about precision screening and individualized treatment. When a folate pathway disorder is suspected, we may need a broader workup, including comprehensive biochemical and genetic testing, and in some settings, even research tools like untargeted broad-spectrum metabolomics. Clinically, if someone has psychiatric symptoms that are hard to explain, especially when they also have cognitive decline, seizures, or progressive neurological deterioration, and their plasma homocysteine is elevated, a folate-related IEM should be considered, and a metabolic evaluation is warranted. By checking markers like plasma homocysteine and methylmalonic acid, we can start to tell whether the problem is a methylation pathway disruption, such as MTHFR deficiency or CBLC disease, or something else. And measuring CSF5-MTHF gives a direct window into folate status in the brain. It can be an important clue when a folate transport problem is suspected. You can think of these biomarkers as a kind of diagnostic dashboard that helps narrow down the cause. If CSF5-MTHF is low, but peripheral folate looks normal, that points more toward a problem with folate transport or utilization in the brain. If homocysteine and methylmalonic acid are both elevated, that suggests CBLC disease or another vitamin B12-related metabolic issue. If methionine is high, that supports CBS deficiency. If methionine is low, that may point to a remethylation defect. Once we identify a subgroup of patients and they show a clear response to folate-based therapy, they should be included in more systematic research. That means collecting standardized clinical and biochemical data, such as changes in seizure frequency, cognitive testing, or improvements in homocysteine.